Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine we put together here at the Virginia Institute for Public Policy. My name is Joe Thomas, and you can find us online at tertiumquids.org. We've got a great program lined up for you, and we kicking off with CraigDiSesa. He is the president of the Middle Resolution and middleresolution.org. If you want to look him up online, if you don't already go there frequently, they have their 2018 scorecard out. Craig, thank you for joining us this week on Freedom and Prosperity Radio. How are you, sir?
I'm well. How are you doing today?
Oh, it's been a busy week. It's been a busy year, and we haven't even gotten into the meat and potatoes of it. We're only just starting to approach Labor Day, and I guess that's where we really start to get into the real, biting time of the season, the political season anyway, and it ramps up big time. And I've been trying to encourage my listeners to look forward into 2019 when we change over the entire Virginia General Assembly. Let's get into first why you keep the scorecard and how you keep it for those who don't go there regularly.
Well, so we got involved in elections in 2009, helping elect folks to the General Assembly. And then around 2011, after we got involved in some of the Senate races, we realized that you can send these folks down there to the General Assembly, but if you don't follow them down there and hang out with them in the General Assembly, they don't always do what they say they're going to do on the campaign trail. Essentially, we need to hold them accountable. So when we do that in a lot of different ways, one is we get involved in primaries. We've gone in and taken out some folks that weren't doing what they said they would do on the campaign trail, and taken them out in primaries and had success with that. But another good way to do this is to let their constituents know how they're voting down at the General Assembly. And so we tried to do a scorecard early on, and it's a lot of work. It's a lot. You have to read all the bills in the priority areas that we've selected, which we've selected fiscal responsibility, which is primarily the budget bill, healthcare, election law, and education. Those are the four areas that we score on. And we find that if you do a good job, you make it very objective, that you can get a real good sense of how these politicians vote. So that's why we do it.
And there are so many things, and for the most part, the Virginia General Assembly has been one of the better ones I've ever lived in. New York, Pennsylvania, Massachusetts, so on and so forth. There are some places where we wish we had a little bit more transparency in the General Assembly, but this year you've upped the ante. You've also told us who the legislators of the year are for the best scores amongst them. But so you talk about all those different things you hold as data points. How long does it take generally to go through everything that happens in a General Assembly, and where's the cutoff point, especially with the latest zeal for special sessions and things like that to be called by the governor?
Well, I think there were a lot of questions in there. So we track everything down to General Assembly. And well, first you have to read all the bills. Mm-hmm. And there are several teams of people, and I give my hats off to the Tea Party Federation and Carol Stopps, who creates a team every year. I'm on the healthcare team. Chris Allen, who put this together, is on the education team. And there are people from all over the state that review every single bill. Now, that takes a lot of time because you're talking about thousands of bills. Mm-hmm. And then we prioritize those bills. And then the Middle Resolution selects the bills that fall into the categories that we score. And then you have to go down to the General Assembly, and you have to watch these folks down the subcommittee, committee, and on the floor. But fortunately, all that stuff is also recorded. The good news about the General Assembly this year was they had video cameras in the committee hearings. They didn't have them in subcommittee, but they plan to have them in the subcommittee rooms when they build the new General Assembly building, which is being built right now.
Okay.
So it's a very time-consuming process and requires a lot of work, people double-checking your numbers and things like that, because you want to be accurate when you call these guys out.
Oh, absolutely, because they're going through this, and they're very worried that these things will get back into their constituents' hands. This year was a little challenging as we had a very big swing in representation for the first time in 5 or 6 years, too, didn't we, Craig?
We did. As you know, as most know, the General Assembly, we had 19 Republicans on the House side, 4 on the Senate side, decide to vote for Medicaid expansion. which is something they've been voting against for, 4 years now.
Mm-hmm.
We fought that tooth and nail. We've been at the tip of the spear on this since 2014. And unfortunately, with what happened in November of 2017, where the House Republicans lost 15 seats, they were still able to hold the majority, but you had 2 or 3 Republicans in the House that were just, ready to cave, unfortunately. So as a result, when you look at our scorecard, there are 19 House members and a number of the Senate members who scored very low because we scored the budget bill. We weighted it at 33%. And so that had an impact on their score. So they were down in the 25% range.
Wow.
On their scores. Yeah. And we got a lot of heat on that. But we also got a lot of feedback saying we did it the right way. I had delegates call me and say, you did it right because the budget bill is the most important bill that we pass. Appropriations is the most important thing we do as legislators. We believe we did the right thing. It was extremely objective. We used no subjectivity, which some people were upset about that as well. But if you make it subjective, then it's worthless in my mind.
Well, and yeah, I think it has to, because you want it to be a data point that people can refer to and say, without looking at political party, just say how they voted on legislation. Because Virginia, for many, many years, was a place where you would find a Chap Peterson voting for something on a conservative's docket, or a Tom Garrett voting for something that a liberal had brought up or a Democrat had brought up. So you're always going to find some of those things anyway. With the Medicaid expansion, I want to get into some of the specifics of the scorecard coming up, Craig. But with the Medicaid expansion, you mentioned how that weighted as they voted on the budget, and that dragged down their scores. Is it obvious to somebody who picks up your scorecard, and you can download it for free at their website, as to who flipped their votes? Much was made over the last year of the Republicans that had spent 6 years saying Medicaid expansion was bad and standing in the way of it, only to now, in many cases, turn over and vote for it. Does that show up in your scorecard as well?
Oh, absolutely. Well, you can just, if somebody scored in the 20s and they're a Republican, they voted for it, because that's the way it's weighted. But what happens, the scorecard is broken down into 4 sections. The first section is just a summary of how we went about this. We let them know in the beginning of session, and at crossover, what our priorities were, where we wanted them to vote on what bills, and so forth. Second section is the rankings. The third section is actually the actual bills that we ranked. And so if you go online, you can click on the bill, for example, the budget bill, HB, I want to say HB 30 and 31. But anyway, you click on that, and then it goes right to the scores, or right to the votes. So you can see where your legislator voted. So it makes it very easy to go to access that data.
Were there any? Oh, I'm sorry, yes. Craig, go ahead.
No, I was just going to say yes. You can absolutely find out who voted for it and who didn't.
So with that, were there any surprises this year as you were going through the data, or did the rankings of our 140 members kind of go the way you were expecting them, or do you go into it with an expectation?
Well, we, of course, were following it pretty closely, so we didn't have any surprises. We knew exactly where everybody would end up. I think one of the surprises that many saw was that one of the most liberal members of the House of Republicans scored higher than the Republicans who voted for Medicaid expansion. Mm-hmm. And the reason why, this is Delegate Sam Razul, who's a Muslim in Roanoke. The reason why is he's so progressive. He actually voted against one of the budget bills that had Medicaid expansion in it because it had work requirements in it.
Right. It had gone too far.
He didn't want any work requirements. So he actually voted the way we wanted him to vote, but for a very different reason. So he actually scored higher than, and a number of Democrats scored higher than some of these Republicans, actually, as a result. So I think that probably was the surprise for most, was that you saw some Democrats score higher than Republicans in some cases.
So who was the highest scoring Democrat on the scorecard this year, Craig?
Let me get to it here. Highest scoring Democrat would be Delegate Sam Razul.
Oh, okay. So
he voted against the budget bill. He scored almost a 50%, so 48.7. And then you had Senator CraigDiSesa. Well, he dropped pretty far down. It drops pretty far down. CraigDiSesa was at 28.7, so he was the second highest.
Yeah, and Sam Rasul actually ahead of Emmett Hanger, who many of our listeners kind of shook their heads about there as well. So this year you also award for the first time for the top score getters. Did anyone get a perfect score this year?
Yeah, we had one Senator Glenn Sturdivant, who actually we're very proud of because we put a lot of work and effort into helping Glenn get elected in 2015. He was the governor's number one target. That seat was because it was an open seat to give back to the Democrats. And Glenn did extremely well. He voted 100%. And then on the delegate side, you had Delegate Poindexter over there near Smith Mountain Lake region, and he scored a 98.9. So he was right up there with Glenn. And you had a number of people. And we consider if you scored 80% or higher, you're 100% with us, and in the sense that not everybody, never always going to agree 100% of the time. It's just not going to happen. So, and a lot of the reason the Republicans scored in the 90s instead of 100 was because we scored every single opportunity they had to vote,
even in committees and things like that.
Right. So in subcommittee, committee, and on the floor. So if there was for example, a lot of folks are assigned to a lot of subcommittees, and they do that for various reasons, and they can't always they have overlapping subcommittees. All right. Well, they can't make each one. So if they missed a vote that we were scoring, then they got a 0 for that score. Okay, because they got a 0 if they voted the wrong way or they didn't vote. 5 if they voted correctly in subcommittee, 10 in committee, and then 15 on the floor correctly. And so there were a number of delegates and senators who missed a vote. So their score was dropped a little bit. It didn't have a huge impact on it. Delegate Rob Bell called me one day and said, "So why did I only score a 96? And I said, "Well, did you miss any votes?" He goes, "Well, of course I missed a vote." And I go, "Well,
that's a 0.
Oh, and he wasn't mad. He's just like, "Oh, I get it now. I see why,
Well, and I guess that goes to priorities too, because a delegate or a senator that has to choose between two subcommittees, you're going to choose the one where it could be argued that they don't think that the votes that are going to cast in this one committee are as important that morning as another one.
Yeah, and it doesn't happen they don't overlap very often. If you're in leadership, you tend to maybe have an overlapping subcommittee, and they just have to decide. They're looking at legislation and they're going, okay, we've got a really bad bill here. We got to make sure this bill doesn't get through subcommittee. So I'm going to show up at this one instead of this one because I'm going to be the deciding vote. That's an example of what might happen.
So let me ask you this one then, and certainly from the radio host side, you want to know who the low scorers were, and that's always a little schadenfreude to get into that out of the 140. But it sounds like yours is also a good way to kind of keep an eye on what Virginians like to refer to, at least in the insider circles, as the pocket vetoes, as some of these subcommittee bills that aren't necessarily recorded, but you guys are keeping track of, and the voters may not know somebody voted against something even getting discussed outside of a subcommittee.
That is correct. We score all the subcommittee votes on the bills that we're tracking. And as I said, when they build that new building for the General Assembly, they're going to have video recordings of the subcommittee hearings, and that'll be very helpful. We recorded a couple of the subcommittee hearings for our own benefits. To have for if we need it for the future and in elections, because some of these folks do some pretty unfortunate things in committees.
Yeah, I was going to say shady things, and they think in a lot of cases that nobody notices. CraigDiSesa is president of Middle Resolution, and he's on with us this week at Freedom and Prosperity Radio. So let's have a little fun. Let's go to the other end. Who is ranked number 140 in your scorecard?
Okay, so great question. So Delegate Dawn Adams, who is right here in the Richmond area, she took one of the seats from Dawn Adams. I believe she took John O'Bannon's seat.
Oh, wow.
And
okay.
she's got a target on her back.
Yeah. Well, it'll be interesting. Now, you've done this scorecard for how many years now?
Well, this is our first year doing it this extensively. We did it early on, and I stopped doing it because it was just so much work. I didn't have the staff to help. And now we have some really sharp people that are working with us, helping us with this.
That's good news, but I'd love to grab some old editions of your scorecard and lay out some of these representatives and see how much their district swung from, in those 14 seats that flipped over. I also look down here and see, to the chagrin of some who have known him a very long time, somebody who had been a relative middle-of-the-road Democrat like CraigDiSesa, usually considered a little less than the firebrand, David Toscano, I guess he's second from the end of ranked 138th there. I guess leadership has its price to pay.
Yeah. You'll see a lot of their leaders in the Democrat side are pretty low. They're down in the 120s, and there's 111 and lower. That's where their leadership is. And
go ahead.
Well, and they have a lot of, for whatever reason, they have a lot more titles than the Republicans do. So you probably got about 30 people that have titles. So they're all down there at the bottom.
Now, you have an asterisk by Terry Austin's ranking. Terry is the lowest ranking Republican at 17.5%. What is the asterisk for?
Yeah, so Terry was sick at the beginning of the session. He had surgery. So he missed a lot of votes as a result. So we just wanted to identify that, and I'm looking for where that's identified, and I don't see it right off the top, but I'm sure Chris put it in here. Mm-hmm. But anyway, he had surgery, so he missed a number of votes on our bills, and that's why he scored so low.
Especially with no such asterisk for Delegate Bloxham, who's at 20% without equivocation, the lowest-ranking Republican.
Yeah, no, Delegate Bloxham missed an opportunity to have a D by his name there.
Well, and I guess so, if that's how the opportunities look. What do you make, and perhaps this is more theory than it is the data that you've collected here, Craig, but the impact of those losses in that swing election and what they're going to be going into 2019. Do you expect that the momentum is going to continue, or are some of these seats that swung going to swing back with more attention to them?
Well, I think most people would agree that what happened in 2017 was a result of the infamous blue wave, or what I call, and many people call, the Trump derangement syndrome. There's a tremendous amount of hatred that's driving this. We have seen it personally with attacks, being called Nazis, all that kind of stuff, and everybody's heard that. So the question becomes, is that energy still there? To what extent is that energy still there? Are these people that are, and it's people that have this tremendous amount of hatred that are driving out the voters. We saw it in 2017, huge turnout. I mean, Gillespie turned out more voters than any other governor in the history of Virginia.
Except,
and he got walloped. So the North and the Democrats turned out that much more. Mm-hmm. So the question becomes, is that energy level going to still be there? I can't tell you. There's no way of knowing. We'll have some sense in November, but then in next November, it could change. The one thing I learned in 2016 is you cannot predict elections anymore. It's just too. I say you can't predict them. You can't predict close races. Yeah. There's some districts where you just know who's going to win, but these close races, and I suspect we're going to get some of those back that we lost, because a lot of these guys are very good at campaigning. And so some of these races that we lost, we'll get back.
Well, certainly like ranked 108 Delegate Chris Hurst, who I believe Michael Bloomberg sent $1,000 per vote into that district in Roanoke to try to flip that seat, and then successfully flip that seat. I certainly don't know if you're going to see that much money coming in from the gun lobbies this year, or if Terry McAuliffe's going to have that kind of money, if he's figuring he's going to try to do either a Senate run for himself, or those special interest dollars may just not be there, Craig.
Well, and you also have to remember that this is last year Virginia was the only game in town, so a lot of money poured into Virginia. So this year, for example, there's all the House seats are up at the federal level, and so forth. So some of that money is going to be spread out over time. So we'll see.
2019 is going to be a big year with every seat in the Virginia General Assembly up for election, all 140 of them, and I think your work is going to be a big part of that. Craig, I really appreciate you taking some time out with us this week and going through this year's scorecard. Perhaps no more important year to have it. I'm glad you've got the team to it. Middleresolution.org is where you find it. Download your own copy of it and have it ready for 2019. Thank you, sir, and have a great weekend, and thank you for joining us.
Thank you, Joe. You have a great weekend as well.
CraigDiSesa, president of Middle Resolution. John Goodman, the author of books like Priceless, one of the great minds when it comes to healthcare reform. You heard Craig and I talk quite a bit about Medicaid expansion in Virginia. We'll get into that coming up next on Freedom and Prosperity Radio. Welcome back to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine put together here at the Virginia Institute for Public Policy. Still one of the seminal moments of my broadcasting career was flying back from Freedom Fest one year with a brand new edition of Priceless by John Goodman, and with a young lady reading over my shoulder all the things that were in there, and she kept saying, yeah, we should do this. And it was a wonderful airplane ride. It went by way too fast, and he is on the phone with us from now the Goodman Institute for Public Policy. John Goodman, welcome back. John, how are you doing, sir?
I'm great. Glad to be with you.
And I think one of the points that it really hammered home to me, though intellectually I knew it, it was clear to me that conservative principles, when put in the right milieu and depoliticized, made more sense to most people than anything else that could be put out there. So again, thank you for giving that. And we're still struggling with Obamacare. I felt like by this point in time we'd be back on a footing heading towards the world put forth in Priceless and the ideas that you were talking about then. Once we got clear of some of the problems legislatively, how have we struggled to get to a better place in healthcare? I feel like, if anything, we may be sliding further into the mud.
Well, Republicans have done a very poor job of this. Obamacare is very vulnerable. It's a big mess, actually, and we have spiraling, a death spiral of premium increases. And there's been a 40% drop among the people who don't get any government subsidies. So healthy people are dropping out and going uninsured. There's been a race to the bottom on networks and that exclude the best doctors and the best hospitals. The deductibles are unconscionable. Chronic patients that need cancer drugs are hit with special out-of-pocket costs. So the Republicans should have been holding hearings every other week on this. And instead, they've ignored it. And the Democrats have taken the advantage now. They're arguing for Medicare for all. They're not even apologizing for Obamacare.
Oh no. Luckily, even some of the, like Vox has published some of the costs that would be entailed in Medicaid for all. So I hopefully they continue to do that. But now the Trump administration, for its efforts, has been trying to do some things, and certainly your discussions regarding health savings accounts and things like that here in Virginia. All of a sudden, we've joined this nationwide Me Too, where all of a sudden we want to do Medicaid expansion, even as that may be going away. The Office of Management and Budget said, don't expect this money to be coming from Washington for very much longer. So Virginia jumping on the Medicaid expansion bandwagon. But talk about what the Trump administration has done with their Treasury rulings on health savings accounts and buying your own health care.
Well, there have been some very important moves by the Trump administration, beginning with what Congress did in the Tax Reform Act. They eliminated the individual mandate. So beginning next year, you cannot be penalized if you don't buy Obamacare insurance.
Yep.
And then the Trump administration has made it easier for association health plans to group together small businesses and certain trades, and that's helpful. And then more recently, they've expanded the idea of short-term insurance. Now, this could be a loophole through which you could drive a Mack truck and I'm trying to convince our folks here in Texas that we can completely transform the individual insurance market with these short-term policies.
Mm-hmm.
Now,
How so?
Short-term used to mean 12 months,
Mm-hmm.
and then Obama reduced it to 3 months. So you could, if you're between jobs or between college and a job, you buy this short-term insurance. But now it's 12 months, and it can be renewed for another 2 years. So now we can go out 3 years with these short-term policies. Plus, the Treasury said the other day you can buy sort of stopgap insurance that ties you over to the next 3 years and protects you from any increase in premium if you get sick. So what we could do by piecing together these two kinds of insurance is we could recreate the market that we had before there was Obamacare.
Mm-hmm. And still, okay, so now we're back to a place where there was still issues with our health insurance coverage. And I remember one of the first times I spoke to you, it was when we spoke at Freedom Fest and Priceless had just come out, back to a place where it seemed like even then the industry had moved away from customer provider, and it had become this kind of closed ecosystem where first you had to get membership into this club before anyone would serve you. And of course, the doctors all had to be members of the club as well. So you had really this very almost, I don't want to use the term monopolistic control over the market, but even more so than Standard Oil did. Not only do they control the providers of the service, but they also control the consumers of the service. So they really have dictatorial control over both sides of it. Do you see this as a way where we can get away from that as well?
Yes, I think what conservatives need to understand is that we haven't had a free market for health care.
Mm-hmm.
Before there was Obama, we didn't have a free market. In fact, for decade after decade, we suppressed the market year after year, decade after decade. And that suppression largely came about first with the doctors, then with the hospitals, then with the insurance companies. And so when conservatives are perplexed about why the market isn't working better, the answer is that the market hasn't been tried.
Mm-hmm. Well, when I first was a young man getting into the workplace, you had really truly health insurance, where just like automobile insurance, if you had a medical situation, you had an insurance policy that you paid into, and an actuarial dealt with it and everything. And I remember the campaign to get us to go into health management organizations, and it was all based around the idea of it'll be so much easier, and the poor sad sack with the stack of paperwork and the piles of sometimes duplicate forms that had to be filled out, and if you filled out one wrong, you'd be denied and everything else. Oh, join the HMO, and it'll be so much easier. And it seems like those HMOs have been the bane of our medical care system since they started.
Oh, yes, and under Obama, they've started up again. They're now called accountable care organizations, and they're something like 32 million people are now connected to these HMOs. A lot of it in Medicare. A lot of seniors think they're in traditional Medicare, and they're not. There's been stealth privatization here, and they're in an HMO that has an economic incentive to alter their care, and they don't even realize it.
Oh, gosh. And that's going to be a wake-up call for a senior who maybe doesn't have the options of flexibility of a 25-year-old.
I'll tell you something even more bizarre. It's against the law for the ACO to tell the senior that he's in an HMO.
What? How could that be possible?
It's part of the law.
Oh, my gosh. So are these, and we saw this in Virginia with the Medicaid expansion, where it was the hospitals that were pushing for the Medicaid expansion and even ran radio advertisements thanking the members of the Senate who flip-flopped on their long-held position that expansion was bad for Virginia. Well, okay, now it's good for Virginia because we're making a cash grab for this. And, at some point, I worry that we're going to get to a place where just like we're watching the people protesting in the streets against law enforcement, when do they start protesting against health care and the hospitals become the bad guys and some political organizations start, as you mentioned, this Medicare for all is going to become the campaign, and we're going to see marches in the streets and race riots breaking out, suborned by politicians who want position, but really not helping anyone get health care, John.
Well, protests in the street don't do any good unless you have some objective. And on the left, it's Medicare for all, but the left doesn't understand that Medicare really isn't a government program anymore. A third of our seniors who are on Medicare are actually in private insurance plans run by United Health and Cigna and Humana.
Yep.
And then the others that think they're in a traditional Medicare plan, as I said earlier, are actually in private sector accountable care organizations where the doctors have financial incentives to alter care, and they're not allowed to tell their patients that they're in an organization that has a financial incentive to deny care, withhold care, alter care.
John Goodman is on with us, the president and CEO of the Goodman Institute for Public Policy Research, one of the great minds regarding especially healthcare reform. It scares me that we're playing a little game of chicken with this, that we see some of the government healthcare programs in Europe, catching up to whether a baby can be provided care. You wind up with stories of the cold bureaucrats determining whether or not the child's life is going to be valuable or not. Are we playing a game with chicken just because it hasn't necessarily happened here yet, that we're really just going headlong down that road, John?
Well, it actually has happened here. There was a famous case down in Florida when Jeb Bush was governor.
Oh, yes.
Where they fought with a family over whether they're going to remove a life support system.
Yes.
That's an issue that's going to be a problem increasingly in the future, regardless of what kind of system we're under. Whether you have capitalist medicine or socialist medicine, we're going to run into those very, very difficult choices. And of course, the benefit of capitalist medicine is the government isn't making this decision.
Right.
The parents can fight with the hospital or the doctors or the relatives. More often than not, it's relatives fighting with each other. But if it's better to do it privately, in my opinion, than to have government making the decision.
Oh, absolutely. But like you said, that's a relationship you've already started with, whether it be an insurance company or a hospital, rather than the government bureaucracy. Because just as somebody who doesn't want to see our government tainted anymore, if they stick their nose in there, they're really setting this premise up against a more the America is failed, Andrew Cuomo, America was never great argument starts to become proven by this. And I worry that that's sort of what we're setting up, is this ability to prove Andrew Cuomo right more than Ronald Reagan right.
Now, if we put aside the people who are possibly brain dead anyway, we come to a group of patients that actually are denied care and who have premature death because the socialist system won't give them care. And that happens in Britain all the time. There's something like 25,000 cancer patients that die every year in Britain whose life could have been extended maybe only a couple of months or maybe much longer because the cancer drugs were more expensive than the National Health Service wanted to pay for. So that's where government medicine makes a real difference for people who otherwise could have had longer lives and maybe even healthier lives.
And even in innovation, this is something that goes back, and I feel like we've traveled this road so many times. The innovation of the capitalist market system, leads to groundbreaking drugs and things like that for an AstraZeneca or a company that will say, hey, let's try to figure out a way to fix this health concern, and then more people will use our medicine.
No, you're absolutely right. And if the left has its way, it'll take all the profits away from the drug companies, and we'll not have new drugs.
So where are we? Obviously, the the Trump administration, with the right to try legislation they signed in, certainly was one of those eye-opening moments where finally we seem to have a president that gets the individual's role in health care. Are we, at least from where you sit, John, tacking towards the right direction, or and if so, how do we continue to steer that way?
No, I think the Republicans have failed to give us a vision of an alternative healthcare system. They're wounding Obamacare, but they're wounding it ways that will be good for some people and bad for others. They have not grabbed the bull by the horns and said, we want an alternative healthcare system, and here's how we want what we want it to look like. I helped Pete Sessions in the House and Bill Cassidy in the Senate with a comprehensive health reform that would have provided a tax credit to every American. And we would have had something like universal coverage, but we would have taken the money that we're now spending and just spent it more fairly, more justly. But the party as a whole has not come to grips with this. They're not holding the hearings to tell the public what they don't like about Obamacare, and they're not giving us an alternative.
When we've talked in the past, John Goodman of the Goodman Institute, author of Priceless, but we've talked in the past about health savings accounts, and now we have in Virginia, believe it or not, Terry McAuliffe signed legislation passed by the Republicans regarding primary care associations. Are there little, as you mentioned, wounding, but are there these little opportunities as Obamacare at least loses the mandate for insurance coverage, where if you can get a good health savings account going and join a primary care association, can you go back and on your own without waiting for somebody in Congress or the Virginia General Assembly to do it on your own?
Yes, you can. I believe in concierge care, and it's becoming relatively inexpensive, like $30, $60 a month, depending on your age. And all around the country, there are these direct care or concierge doctors that talk to you by phone and by email, and they're 24/7, and they allow you to buy drugs at prices that are cheaper than what Medicaid pays. So there are all kinds of innovations out there in the marketplace, and federal policy just interferes with all this. Right now, you can't use your health savings account money to pay a concierge doctor. We need to change that quickly.
Yeah.
We need to give the Medicare folks an opportunity to do the same thing. And they should have a health savings account, and they should be able to have a concierge doctor. And what I've been trying to convince the Republicans is if they would go out and campaign on bringing Medicare into the 21st century, they'd get a lot of senior votes. But they're not doing it.
How so? How do you mean into the 21st century?
Well,
through these...
if you're a senior on Medicare, you can't talk to your doctor by phone. You can't talk to your doctor by email. You can't use Skype. On the East Coast and the West Coast, there are Uber-type house calls. So for $100, a doctor will come to your home in less than an hour, cost $100. If you went to the emergency room, you'd pay 5 times that. You'd wait 2 or 3 hours. Medicare won't pay for that.
Really?
No, it won't. So Medicare is living in the dark ages. It's paying for the services that were around 40 or 50 years ago when it was formed. And we ought to, the right way to change all this is to tell the senior, we're going to put $2,000 or $3,000 in an account for you. It's tax-free. You manage all your primary care. Now, if you don't want to do it, you don't have to do it. But younger seniors, I think, would want to do it, and then let the market compete. The concierge doctors, the Uber-type house calls, you could have all of that.
Well, I know we've talked in the past that if a 25-year-old started a real, almost 401k style health savings account, and there's still legislation that I understand, trips that up from happening, and grew it all the way through their senior years, they'd have enough, in their health savings account where they could be gifting their grandchild with health care if the government would get out of the way and let them do it that way. But it seems like there's a profit motive for politicians from keeping us being able to do that.
Well, we had to fight vigorously to get health savings accounts in the first place. And I first proposed the idea in the early 1990s. There were only 5 members of the House that of Representatives that would back a bill, and we were opposed by all the special interests, the doctors, even the small business lobbies were against us.
Sure.
But then, with the passage of time, we won folks over because the big insurance companies decided, well, the public isn't going to put up with HMO care, so we might as well let people manage their own dollars. Mm-hmm. So in 2004, we got expansion of health savings accounts, but we've had to fight every step of the way, and the special interests continue to try to limit what you can do with these accounts, and that's too bad. What I've said to Republicans in Congress is, let's don't do the little stuff, let's do the big stuff. Mm-hmm. Instead of trying to chip around the edges, let's say we want to give people the opportunity to manage their own health care dollars. And we don't need to put a lot of restrictions on it. The IRS already has defined what a health care expense is, and let them buy over-the-counter drugs, let them pay for concierge doctors, let them have telephone and email or anything the market has to offer.
Mm-hmm. Well, in the days of Amazon and that kind of thing, where you can order something from wherever and have it shipped to your house within a couple of hours, you really think we'd be in a place where we could do that more, John, wouldn't you?
I wrote in Forbes the other day, we could probably cut the cost of health care in half if we just take advantage of telemedicine. Mm-hmm. Now, this is something else that Medicare has been very slow to pay for. Until recently, it wouldn't pay for any of it. So you have Mayo Clinic treating stroke victims out in rural Minnesota, where doctors have never seen a stroke victim before, and they're saving lives, improving health, but Medicare wouldn't pay for it. Now Medicare will pay for telemedicine to rural areas, but not in the city. Well, the city is where most people live.
And it's still, it's often just as hard to get to a hospital in a city as it is in a rural area.
With technology no more sophisticated than your iPhone, doctors, specialists at hospital can examine you in your own home.
Mm-hmm. Get all the data.
They can do all kinds of tests you wouldn't believe, and that technology keeps improving every day. So you don't have to get into a car and go to the hospital and wait for care. Mm-hmm. You can have care delivered to you conveniently.
John, what are the special interests? Because it seems like if I was a doctor, I would be on your side, saying, yes, let me go just treat people. And how is it they've been herded into this group of special interests? I get it why an insurance company doesn't want you to be able to do it on your own. I get it why hospitals don't want to get you doing it on your own. Is it because the hospitals now own the doctors? Has it become so expensive to be a doctor that you have to associate with a hospital, therefore you have to agree with them? What is the reason that the doctors are along with this?
Well, the older doctors are not used to the technology, and so the American Medical Association, for many years, opposed the idea of a medical consultation that didn't involve face-to-face encounter with doctors and patients. Mm-hmm. So older doctors have been slow to like this, and then we're in a payment system where all the hospitals and all the insurance companies are used to doing it a certain way, and they've invested a lot of money in systems that are set up to be paid that way. And so they're going to have to rethink everything. And there are hospitals who are doing it, but they're just not getting paid. They're not getting paid by Medicare. They're not getting paid by Medicaid or Blue Cross. So they're leaving a lot of money on the table just to practice medicine the right way.
Are groups like Dr. Josh Umber and Atlas, and I mentioned Virginia just signed in those concierge care, signed in a law permitting for those to perform here in Virginia. Are the millennial doctors, the 20-somethings and 30-somethings, getting the idea of why should I want to sign into this old school stuff? And are they the future that we should be looking at and legislating for as well?
Yeah, all the concierge doctors that I know of are 24/7 by email and phone, and they're always there for their patients. And but so is your lawyer, so is your accountant. It's just the doctors are like Dr. Umber that you mentioned. I mean, he's practicing medicine the way other professionals serve their clients. Mm-hmm. Most of the time, when I deal with lawyers or accountants or other professionals, it's not face to face. Most of the time, it's by email or phone.
Yeah. And you send back and forth. Can you imagine the legal profession if we had HMOs for law? I shudder to think about it. John, thank you so much for your visit this week. Who should we be talking to legislatively about this? Are there politicians? Are there members of the House and Senate we should be emailing to encourage them off the fence? Especially here in Virginia, are there good ones, bad ones, ones that we need to kind of encourage with an email or a phone call?
Well, I think all the leadership needs to be alerted, and the way Republicans work is they don't do much unless the leadership goes along with it. So we need Paul Ryan over in the House and Kevin Brady, who's head of Ways and Means, and they need to understand that we need to quit talking about just abolishing Obamacare with no replacement.
Right.
No one ever wanted that. Now, the voting public, they don't like Obamacare, but they want a replacement. They want a system that works better. And that's what we need to be focusing on.
Well, they should all be given a copy of Priceless as well. But Dr. Goodman, thank you, John. I appreciate it, and I appreciate everything that you do now with the Goodman Institute. Find them online at goodmaninstitute.org. John, thank you so much, sir, and we appreciate your visit this week on Freedom and Prosperity Radio.
Glad to be with you.
And thank you for listening. For all of us here at the Virginia Institute for Public Policy, so long, and thanks for all the fish.